Lung cancer continues to be a major health concern in India, and tobacco use is a leading cause. However, the implementation of tobacco control policies has shown promising results in reducing the burden of this disease. According to a study conducted by the World Health Organization, implementing comprehensive tobacco control policies can reduce tobacco use by up to 30%.
Worldwide, the tobacco control policies, they mostly follow a framework set by the WHO, and it's called Empower. So most government policies, including our national policy, is in sync with that. So one thing is they monitor the tobacco use, protect others from, let's say, secondhand smoke, offer help for anyone who wants to go through a pathway of quitting tobacco, because we know that's not easy, and also warn others about the ill effects and the disastrous, deadly consequences that can happen from consumption of tobacco.
One of the notable examples is the introduction of pictorial warning on cigarette packets in India. These graphic images have been proven to effectively convey the health risks associated with smoking and discourage tobacco use. Research shows that countries with large pictorial warnings have higher rates of quit attempts among smokers. Additionally, higher taxes on tobacco products have been instrumental in reducing tobacco consumption. A study published in British Medical Journal that a 10% increase in cigarette prices could lead to a 4% reduction in cigarette consumption. This demonstrates the significant impact of pricing policies on discouraging tobacco use.
The problem is that when an oncologist gets a patient who is a smoker, or say a former smoker, and comes to you with a tobacco-related cancer, that can be a lung cancer, that can be a head or neck cancer, or an esophageal cancer. There are some other cancers as well, like bladder cancer, bowel cancer. Those can be related to tobacco consumption as well. In India, however, most cancers are oral cancer, head neck cancer, lung cancer, and all those things. But it's already too late by then. Although we could ask everyone to teach our population to stop using tobacco further, but the damage has been done by the time. So the population who would benefit the most from such tobacco control policies and tobacco cessation are the ones who are yet to develop cancer. Because once you stop tobacco, you are not free from cancer risk, but every year that you are abstaining from tobacco, your risk of developing cancers go down.
It is important to note that tobacco control policies not only focus on prevention but also on providing support for those who want to quit. Quitting tobacco can be challenging, but with accessible and affordable cessation programs, individuals have a better chances of success. While progress has been made, there is still work to be done. Continued efforts to strengthen tobacco control policies, enforce regulations, and raise public awareness are crucial in reducing the lung cancer burden in India.
The most effective step in tobacco control and reducing the tobacco-related mortality and morbidity would be complete ban of tobacco. So every policy says about reducing the use, warning people, raising taxes. But I think there has to be more governmental support and intent to completely ban tobacco, because we know that's possible. Because if we look at history, opioids, other cannabis, that was also once readily available, but that's banned in most countries. So I don't see a reason why tobacco cannot be banned completely, because there is no safe dose of tobacco.
Together, we can make a difference. By supporting and advocating for effective tobacco control policies, we can protect the health and the well-being of our communities and work towards a tobacco-free India.